So how much advantages for replacement joint and this one?
So for example, there are many joints in the body. You're talking about hip, knee, ankle, shoulder, everywhere. In hip, if you say, for example, avascular necrosis of the hip because of the COVID, so a lot of people presented AVN of the hip. So if you catch the hip AVN, early stage, like we grow the cartilage cells, we also grow the bone cells. So where we can remove the dead bone from the hip joint and then put this cultured osteoblast into the hip. That means you are getting a normal hip back and not going for the hip replacement. So basically we are trying to educate the people that earlier diagnosis of all the disease can be cured naturally. That is, we can restore the mobility naturally because your natural hip is natural, natural joint is natural. So keep the metal away.
I think one thing is, both are different treatments done in different stages of disease. In early stages to medium stages, we can go for joint preservation. Late stages is for joint replacement. But so it's not a competition between which is better, joint replacement or preservation. Early stages, joint can be preserved. Late stages, it is generally not worthwhile to try and preserve the joint. Those stages are for replacement. Similarly, early stages, we don't replace.
Also, a lot of times we get referred to as frozen shoulder, but not all frozen shoulder is frozen shoulder. There's so many reasons. Same thing, not all joint pain is arthritis and not all arthritis we treat by replacement. Because of the fear that you go and complain of pain in the joint, get it checked, whether they'll be told to have a knee replacement. That is delaying a lot of people, putting away a lot of people from even getting it checked and investigated. Like with a variety of various imaging Dr. Chidambaranathan showed earlier on, we're able to do cartilage mapping, we're able to do various x-rays and identify some of them who may be suitable for this joint preservation because they're not in the later stage of the disease. And of course, when the knees or the joint is so deformed, it's easy to diagnose and the option, yes, maybe a full surgical option. But what we are trying to achieve here is to create awareness, to catch them early so that we can use some of these joint preservation techniques in various forms to preserve their natural joint.
So it's like, putting it simple way, whenever there's an injury, the joint takes about 4 to 6 weeks to heal. So the same injury, if you're going to put some growth factors or platelet-rich plasma or so many things, we put millions of cells into the injured area. So the body is, it's like going to the war. You have one soldier, you have 1,000 soldiers. So something like that. The joint preservation is like that. We use various modalities. Starting from platelet-rich plasma, we have this bone marrow concentrate that is taken from patient's own blood, making a concentrate, putting in the affected area. And we have this lipoaspirates. That means your own fat cells. That's not billions of cells. So that can be also used in injecting into the affected area. So these are the things where we are helping our body to heal with the body's own cells at an younger age, early age, as I was mentioned.
Dr. Navaladi Shankar, Senior Consultant Orthopaedic Surgeon at Apollo Hospital, Green Road, Chennai. Today we are talking about joint preservation program. It has been launched so that almost 6 million people have been affected by arthritis in India. So we wanted to preserve them, prevent them to undergo arthritis. So that's the reason we started this program, where we catch up the joint which is undergoing early arthritis, so that we can treat the early arthritis, maybe a sports injury person or a middle-aged female, so that from there we can do like this biologics, like this cartilage replacements, like this bone transplant, so that they don't go into the future metal hip or knee replacement. So getting them at the earliest. So we have a gamut of options. starting from PRP to bone marrow concentrate to hypoaspirate to the cartilage transplant, bone transplant, everything is being practiced at Apollo, so that basically we have to diagnose the arthritis early so that we don't go to the replacement at a later stage. So we want to take away the metal and come into the natural bone, natural cartilage, natural ligament, natural meniscus.
About this program, who was the chief guest on that? 1 minute, somebody.
We,
Today.
we thought we'll invite the chief guest, Senthilnathan, who was with MRF based foundation. So these are the people who see a lot of sports people, who bring up a lot of sports. They see a lot of sports injuries, so that to bring them to the knowledge of the sports people, because everybody are talking about sports injury is only ligament tear, meniscal tear, reconstruction, meniscal repair. But beyond that, you see a cartilage injury. So that cartilage injury has to be addressed so that the sports person can go back to their sports. Otherwise doing only ligament reconstruction, leaving the cartilage, they're not getting back to effective sports. So where we have to treat the cartilage defect also and treat the cartilage injury also. So that's a basic idea to get the sports academy of Tamil Nadu or all over India to get into that.
Thank you, sir.
And this joint preservation is good for the IT people, young people, because young 30-year-old female coming to us with the anterior knee pain, they think it's nothing, just motivally அப்படின்னு சொல்லிடுறாங்க. அது கிடையாது. நம்ம வந்து என்ன ப்ராப்ளம் ஒன்றில் சொல்லி earlier diagnosis பண்ண அந்த cartilage, அந்த குருத்தெலும்பு அப்படின்னு சொல்லுவாங்க. அதுதான் பேசிக் ஃபங்க்ஷன் ஆஃப் ஆல் த ஜாயின்ஸ். அதை நம்ம டயக்னோசிஸ் பண்ணாதான் சீக்கிரமாகவே தேய்மானம் ஆகிறதுக்கு நம்ம முன்னாடியே ப்ரிவென்ட் பண்ணுறோம். அதுதான் ஜாயின்ட் ப்ரிசர்வேஷன்.